This is part 2 of lecture 1 for phlebotomy. We're going to talk briefly about proper telephone etiquette. Telephone etiquette and protocol is very important in the laboratory. Frequently at facilities, they have trained you in what they would like you to say on the telephone and how to answer the telephone. It's always important to remember, even when you become flustered or it's really busy or really stressful, to have a calm voice on the telephone and to address everyone with respect and make sure you follow up on what you say you're going to follow up. So it impacts the quality of patient care, not only because you're speaking to other caregivers and possibly physicians, but you may be speaking to patients and their families. And remember that a lot of times the phlebotomist role includes clerical assistance. When we talk about healthcare delivery, we talk about two general categories of facilities: inpatient or non-ambulatory, and outpatient or ambulatory. Inpatient is typically what we think of as in the hospital. Non-ambulatory means these patients can't move. Often they are confined to a bed, so you may be drawing them in a bed or a wheelchair. Outpatient are things like physicians' clinics, wellness testing sites, nursing homes. Sometimes in nursing homes the patients are ambulatory or non-ambulatory, but most often we think of outpatients as ambulatory, that is, they can move. This is a graph of how laboratory departments are sometimes set up within a hospital. This most specifically applies to large hospitals. You can see that there's very much a large reporting structure. Each department has a supervisor. There's an overall director or administrator of the laboratory, and oftentimes that's the pathologist, or it may be an actual vice president or someone with a master's degree with a higher degree. Usually in the clinical lab, there's two major divisions or areas. There's a clinical analysis area where all the specimens are run, so the blood and the urine, the stool, and other specimens. And there's also the anatomical and surgical pathology area, where when people have surgery, anything that they take out, any tissue, any lesions, any moles, any organs are reviewed, in addition to cells and other specimens like that. All laboratory testing, of course, is associated with one of these two areas. So in the clinical lab, you can see what the clinical analysis areas are, and I'm going to pronounce them for you so you hear the words at least once, but please take the time to go ahead and practice saying them yourself. The clinical analysis areas are hematology, coagulation, chemistry, serology and immunology, urinalysis, microbiology, blood bank, and immunohematology. So you can read there what each section is responsible for. In the anatomical and surgical pathology, the categories are typically histology, cytology, and cytogenetics. So these are all branches of laboratory medicine that you need to be aware of. One of the main principles in phlebotomy and in laboratory testing in general is that our results are only as good as our sample. If we don't have a good sample to start with, we're not going to give the doctor good results to work with. So remember that we use samples to diagnose maybe a new disease or follow a disease process. We use it to evaluate treatment or drugs they may be receiving, and we use it to monitoring the disease and the treatment of the disease. So lab results in 7 out of 10 patients are the basis for the physician making the diagnosis. So even though there are lots and lots of other tests like CTs and MRIs and X-rays and all sorts of things, the physicians really rely, or the clinicians really rely on laboratory tests to make the diagnosis. Sometimes and frequently, we in the laboratory are the first people to know something is wrong or what is wrong with the patient. So at the basis of all this is the sample. So the sample has to be correctly obtained, it has to be correctly handled, and it has to be correctly processed in order to give the physician accurate results. You may think, oh, it's a lab test, so what? That's not a big deal. Well, let me tell you, a delay in the lab test may delay treatment. So if it takes an hour to get a lab test back that should only take 15 minutes, that patient could be sick enough that they're already severely compromised and could in fact be doing very worse off before they get the lab result back. So we have to be timely so the physicians get that information in time to start treatment. For instance, in the case of someone with bacterial meningitis, an hour can make a difference between literally life and death. That patient could be sick when they come in and they could be dead in an hour. So we have to hurry and get those results back. We need to make sure the samples are tested correctly because there's some things that can interfere if the sample isn't handled correctly. There are some values that may be lowered or raised if the sample sits too long. And again, then we have to sort out what's really going on with that sample. So if we get a good sample, we handle it correctly, we process it promptly, and we test it as soon as possible, then we are doing what we need to do to get the physician his results. So there's a government organization called the Institute of Medicine, and they actually study healthcare in the United States. And they really work hard to help educate healthcare providers to make healthcare better. And they say that in order for healthcare to be as effective as it can be, in general, we have to do what we do safely. We have to be effective. We have to put the patient at the center of our decisions. So every decision we make has to be what's best for the patient. So for instance, if you're a phlebotomist and you have a patient that's maybe difficult to draw and you know you're the best person to draw that patient, you need to ask yourself what's best for the patient. Is it best that I let someone else draw them, or is it best that I draw them? Is it best that I be efficient in my work and get the sample to the lab quickly? What is best for the patient? We have to be timely. We have to do what we say when we say and as soon as we can get it done. We have to be efficient. We can't waste time. We have to keep our trays stocked so they're ready to go for the next person so we don't lose time when we go out to draw that patient. And healthcare is supposed to be equitable. That means everyone's treated equally and everyone's treated well. So as a phlebotomist, you can impact outcomes in all these areas. So by what you do, you affect what happens to that patient. And this is the end of lecture number 1.